The most important point about how we're doing deep brain stimulation surgery at Good Samaritan Hospital is really the fact that we're a generation ahead of how it's commonly done. Usually, even now at this point, patients, when they have deep brain stimulation surgery, it's an all-day affair. It takes the entire day. They come in at 5:30 in the morning. They have to be completely off of all their medications, and they're very stiff. Then they have to go and get an MRI scan. They have to have a frame placed on their head, and they have to have this patient, the patients have to be awake during the procedure. So they have to participate, and it can be quite tiring. We've had instances in the past where patients would be so tired from the surgery from one side that they'd say that they can't do the other side. So it's quite difficult on the patients, and especially if they're claustrophobic, being in an OR surrounded by drapes is not easy. I think the advantage of how we're doing at Good Samaritan Hospital is that we're doing all of our Parkinson's patients asleep. So they come into the hospital in the morning, we keep them on their medications, they come into the operating room, and they're put under general anesthesia. The next part that they'll realize is they'll wake up in the recovery room and everything is done. Of course, a lot of work is being done in the operating room, and usually takes us about 3 to 4 hours, but only about a small part of that is the actual surgery. The bigger part of that is the setup. But generally about 3.5, 4 hours or so, we're generally done with the surgery. And some patients say that they should have done it sooner because we've made it really easier and simpler for patients to do.